Assalamu alaikum students. Today we will discuss lecture 9 and the topic is types and assessment of bioavailability. Discussion outline for today's lecture, we will be discussing types of bioavailability including absolute and relative bioavailability, various methods of assessment of bioavailability including pharmacokinetic and pharmacodynamic method. So, the absolute bioavailability is determined whenever the systemic availability of a drug which is being administered orally is compared to its intravenous administration, and area under the curve is used as a very important pharmacokinetic parameter to estimate the bioavailability. The equation used is as given on the slide, as you can see on the screen. Okay, the relative bioavailability differs from the absolute bioavailability in a way that in this case also the comparison between two formulations is being performed, but one of the formulation is a test drug while the other one is a reference standard drug and not necessarily an intravenous administration. So, for example, the comparison may be between the non-aqueous or aqueous solution or suspension of a drug, or it may be between the capsule and suspension of a drug. So, the important point is that the other formulation with which the test drug is being compared is not an intravenous administration. Otherwise, it would be the measurement of absolute bioavailability, not the relative bioavailability. While the equation used is almost the same as we discussed earlier in case of absolute bioavailability, the only difference is that in this case, area under the curve for the other drug would be for any other formulation but not the IV. Various methods are used for assessment of bioavailability, which can be roughly organized as the indirect method or the pharmacokinetic method and the direct method or the pharmacodynamic method. In case of pharmacokinetic method, we perform the plasma level time studies, and in that case the plasma level of the drug are compared or plotted versus time, and the curve obtained is helpful to determine some very important pharmacokinetic parameter like Cmax, Tmax, and area under the curve. Now, urinary excretion studies are performed the same way as the plasma level time studies, but the only difference is that the sample being collected is urine, not plasma. In case of pharmacodynamic method, the acute pharmacological response or therapeutic response is measured. So, as I just mentioned that in case of pharmacokinetic method, we perform the plasma level versus time studies in which the plasma level of the drug is plotted versus time, and then you obtain a curve. Now the curve which you can see on the slide is representative of orally administered drug because the level is rising from the minimum concentration to the maximum and then further it declines again, so that's how the completely elimination of the drug occurs. So here you can easily spot the Cmax point, and it's relevantly can be accessed at the x-axis to the point which is called Tmax. Now Cmax is the peak plasma concentration, while the Tmax is the time taken to reach peak concentration. And as it is telling you that in how much time you reached the maximum concentration within the body, so it is specifying the rate of absorption. On the other hand, area under the curve is the plasma level time curve, and it gives you an overall measurement of extent of absorption, or like how much amount of the drug gets absorbed rather than the rate. However, these three parameters are very important parameters whenever you want to determine bioavailability, because Cmax and Tmax is telling you about the rate, and area under curve is telling you about the extent of absorption. Next one is urinary excretion method, and if I spot the difference between the urinary excretion and plasma concentration method, the only difference which I mentioned earlier is the difference of the sample. In this case, we are collecting urine samples, and secondly, it is applicable to the drugs which are extensively excreted unchanged in the urine, as we know that drugs are metabolized in the liver and they are excreted in the urine as well. So this method is specifically applicable to the drugs which are extensively excreted unchanged in urine. Few of the examples of such drugs are thiazide, diuretics, sulfonamides, urinary antiseptics, nitrofurantoin, and hexamine. And the equation you can see is just like other equations used for the assessment of bioavailability. However, one factor which you can easily find here different from the other equations is XU. Now, what is XU? Is the accumulative amount of the drug which is excreted in the urine. However, it is comparable to area under the curve. The reason is that area under the curve is telling you that how much drug gets absorbed, extent of absorption, while XU is the cumulative amount of drug which is being excreted in the urine. So definitely that both terminologies are telling you about the drugs which is or which was present in the systemic circulation. In this diagram, you come across with three important parameters in connection to urinary excretion method, and those three important parameters are maximum urinary excretion rate, which is determined at Tu max, which is time for maximum urinary excretion rate, and Xu, which is cumulative amount of drug excreted in the urine, and we already discussed about this one. So, in case of pharmacodynamic method, acute pharmacological response is measured, and this method is applied whenever the plasma level of the drug is that low that it is difficult to accurately determine, or it is non-reproducible. So, in that situation, the acute pharmacological response could be used instead, and there are several examples, but one of the examples is of cardiovascular drugs which are capable to induce a change in the ECG reading. So that pharmacological response could quite be a reflective of the bioavailability. Similarly, some drugs can induce a change in the pupil size. Some drugs might cause the dilatation while others cause the constriction. So, the change in the pupil size or diameter is another important pharmacological response which is used as a measure of the bioavailability. Now, the disadvantage of the method is that it is variable, as we know that the drugs response vary from one individual to the other individual based on various factors. Similarly, the drugs might be producing the active metabolite, which are sometimes having the same pharmacological response as the drug, or sometimes might be more potent than the parent drug. So that results in the interference with the results, with the final results, and results might not be more reliable. Apart from acute pharmacological response, therapeutic response is also measured at times, and what happens in this case that the clinical response of a drug formulation which is being administered to a patient suffering from disease is measured, and again this method is important and gives significant information about the bioavailability, but result is variable and not reliable, as it is only qualitative, not a quantitative one. Okay, students, lecture is still continued and soon I will be coming up with another lecture.